Senator Hatch.
Well, thank you, Senator Brasso. It's a privilege for me to be with these two physicians in the Senate who really understand this better than anybody else right from the start, because they've actually practiced medicine. Both of them, both are excellent physicians. Both of them are specialists, and we're lucky to have them in the Senate, and we ought to listen to them. You know, with each passing day, another one of the President's promises on the new health law bites the dust. He said that after their $2.5 trillion health care law, that wouldn't add one dime to the deficit, even though CBO said that it would. He said that it would control costs, but the administration's own actuary said that it would do just exactly the opposite. He said it wouldn't increase taxes on Americans earning under $250,000 a year, but an analysis by the Joint Committee on Taxation found that it would. And now yesterday, the administration issued new regulations governing existing health plans. And guess what? 87 million Americans will be forced out of their current coverage. Now, what happened to the President's pledge about if you like your plan, you can keep it? In response, I wrote to the President a letter outlining my concerns with these new regulations, and Antonio will get each one of you a copy of that letter. Specifically, I cited the perverse incentives in this misguided law for employers to drop health coverage, and the more people employers drop coverage for their employees, the more the federal government has to pick up the tab. Keep in mind, they moved, of the 32 million people they claimed they were going to get insurance for, 16 million of them they moved into Medicaid at a time when the states are $200 billion in the hole. I mean, it just doesn't make sense. An analysis by former CBO Director Doug Holtz-Eakin found that health law provides strong incentives for employers to, quote, drop employer-sponsored health insurance for as many as 35 million Americans, unquote, and, quote, raising the gross cost of the subsidies to roughly 1.4 trillion, unquote, in the first 10 years. Now, that's why I'm introducing an amendment today to exempt those businesses from the employer mandate if they certify to the Departments of Labor and Treasury that it has forced them to cut jobs. Instead of spending more and more taxpayer dollars on government programs, let's get the businesses back to the business of hiring people. The bottom line is this: millions of Americans will lose their current coverage at a cost of trillions of dollars to the taxpayers and to the federal government, all while the administration's credibility on health care continues to bite the dust. Now, we have two excellent doctors here today who both have lived with the past system and who understand what they're trying to do to us in this administration and in this bill that passed in a totally partisan way both houses of Congress. I think we ought to listen to them. These are folks who have really lived with these problems. And as a former medical liability defense lawyer, I've got to tell you, these two fellows really know what they're talking about, and we ought to pay attention to them.
Thank you. It is surprising the regulations that were